5 facts about kneecap dislocation or patellofemoral dislocation. The kneecap moves against the thigh bone, and that joint is known as the patellofemoral joint. So fact number 1, the kneecap generally can move outwards or laterally. So almost all kneecap dislocations are lateral patellofemoral dislocations. Fact number 2, the kneecap is stabilized in a groove on the thigh bone by the shape of the thigh bone groove, which is generally a dip, which means that the kneecap can move in a straight line on the thigh bone. Fact number 4, the kneecap is also stabilized by a ligament known as the medial patellofemoral ligament, which passes between the thigh bone through the kneecap back into the thigh bone. There are also a couple of other ligaments, one of which is the medial patellotibial ligament. Fact number 5, as well as the bones and the ligaments, the kneecap is also stabilized by a quadriceps muscle known as the vastus medialis obliquus, and that's a quadriceps muscle that inserts into the inner or medial aspect of the kneecap, and that's called the inner range quadriceps, or VMO.